Power of One. Today, we're going to be speaking about a very important issue: mental illness. Please understand, mental illness is a disease. So if you come across anyone who has a mental illness, please know that they need help. Do not react if there's a situation that goes bad. They may need help. Today, I have the pleasure of speaking with Dr. Sarah Noble, and she will uncover some great facts and some great things that we need to know about when we're dealing with people who have a mental illness, whether it's a neighbor, whether it's someone in our family, whether it's a coworker. We want to make sure that we are taking care of them at all times. Welcome to the show, Dr. Noble.
Thank you. Thanks so much for having me to talk about this very important topic.
You're more than welcome. Dr. Noble, let's just dive right in. Let's talk about mental illness and how it affects people.
Sure. So mental illness, it can come in a very wide variety of presentations. If we look at the DSM, which is kind of the encyclopedia or dictionary of diagnoses, it can be things like depression or anxiety, depression being very severe sadness, anxiety being very severe worry. And then there are things like bipolar disorder, where you see people sort of cycling through real high highs and real low lows. And then there's the psychotic illnesses where folks will struggle with essentially their mind playing tricks on them. They start to see things that aren't there. They hear things that aren't there. They might imagine connections between things that don't exist, so that they believe that people might be out to get them, or that they are in trouble, or things like that.
Dr. Noble, you spoke on a couple of things: depression, anxiety. And I think that the everyday person, correct me if I'm wrong, we experience, I know I do, experience anxiety. I experience depression. Today was a very hard day for me. I have a grandson who's in kindergarten, and the bus driver let him off at the wrong bus. I knew something was wrong because I was calling my son and my daughter-in-law. They weren't answering me. So that anxiety was unbelievable. And then when they answered my call, my daughter-in-law says they lost my child. I just screamed to the top of my lungs. Dr. Noble, we have these experiences all through our life. Can those experiences lead to mental illness, or are we built for those stressors? And I know it's good stress too, like a bride who's getting ready to get married. Those are good stress. It can, not the good stress, but those things, when you're going through those things throughout your life, you have so many ups and downs. Can that lead to mental illness?
100%. So the way that we can conceptualize mental illness these days is that there are a bunch of genes that probably contribute to mental illness, and you might be born with some of those genes. And then depending on your life circumstances, depending on how many stressors you experience, those genes are more or less likely to get turned on. So, the person who is born into poverty with, exposed to lots of violence, especially in childhood, we know that early childhood experiences, adverse childhood experiences, can definitely predispose to mental illness. We also are recognizing increasingly that racialized trauma, so the experience of the systemic racism, increases the risk of mental illness. So certainly, yes, the more severe the traumas, the more frequent the traumas that one experiences, the more likely those genes are to get turned on and for the manifestation of mental illness symptoms.
Okay. Now, with mental illness, you have some people that are able to live a normal life.
Mhm.
And does everyone with mental illness have to take medication for them? Because some we can actually see, you know
Mhm.
what I mean? Some of them, you actually see that the person has a mental illness, whether they're going up and down the block, talking to themselves, screaming, or things of that nature.
Mhm.
Can do they have to take medication? And then is there someone who has a mental illness where you would never know because they take medication? Or can someone have a mental illness and not be prescribed anything?
So this is a huge debate within the psychiatric community. The general rule of thumb, I will say, is that um, the more severe the illness, the more recommended it is that one get on medication early and stay on it. Um, so, for example, things like schizophrenia, um, the the treatment, the recommended treatment is first episode of psychosis. It's very important to get onto medication and stay on it, and that will decrease the likelihood that the symptoms will get worse and be difficult to treat. Things like a minor episode of depression or anxiety, the evidence is less clear. Um, you don't necessarily need medication. Therapy could work, um, and one could recover and go about the rest of their life.
Okay. So please tell me what someone can do for their loved one who may have a mental illness, even their neighbor who may have a mental illness, and certain family members are not forthcoming. And you
Mhm.
see this person that they're dealing with this mental illness, but it seems like help is so far away. Because if you 302 someone, and you can explain what that 302 means,
Mhm.
if you 302 someone, they can check themselves out in 32, or is it 72 hours?
Um, so, so a 302, to just sort of explain what the terminology is. So, a 302 is an involuntary hospitalization. And the way the law works is anyone can 302 any other person. So, um, and it's good information to know because if you have a family member or a friend or a neighbor and you believe that they are a danger to themselves or others, say they've told you that they're suicidal or they are starting to threaten other people, you can go to your nearest psychiatric crisis center and you can write out a 302 that will be called into the mental health department. And then that 302 can be used to call the police and have that person taken involuntarily to the nearest psychiatric crisis center to be evaluated. That 302 is then only, that's all it's good for. It takes them to the hospital to be evaluated. Once in the crisis center, they're then evaluated by a psychiatrist who determines whether they want to uphold the 302 and actually put them into the hospital. So that's sort of like the next hurdle is, does a psychiatrist actually agree this person is a danger to themselves or others? Um, and then the next step is that if they do agree and they put them in the hospital, they that within I can't remember the exact amount of time. I think it's 36 to 48 hours. They have to go before a judge, a mental health court judge, who will determine whether, based on the evidence before him or her, the person needs to stay in the hospital because it's actually a legal document.
Okay. So they may not be able to sign themselves out if that psychiatrist or the judge sees that no, this person is not fit
Hmm.
to be out on the street, then they can actually still be held.
Hmm. But the defining decision is based on, is this person a danger to themselves or others? And honestly, that is a challenging criteria to meet, because just because you're talking to yourself or you're, think that people are out to get you doesn't necessarily mean that you're a danger to yourself or others. Um, and so, as somebody who's made that decision in the crisis center, should I keep this person in the hospital or not? And I have to make it based on this legal definition, danger to self or others. It's not always easy to make. Um,
I
yeah.
can imagine. Does drugs, alcohol, which I know alcohol is a drug, does alcohol and drugs play a part in someone who has a mental illness that should not be consumed, correct?
Yeah. I mean, in general, drugs and alcohol, just they affect people's decision making capacity. I mean, none of us are make good decisions when we're inebriated. And if you're already in a place of maybe, being not in your best emotional state because of being unstable, not maybe being on your medications, and then you add in drugs or alcohol, it just kind of stirs up the pot.
I
It
want to go back.
also, I would say, probably can add to the, when I was talking earlier about those sort of compounding factors that can turn on the genes that trigger mental illness. Drugs and alcohol definitely can do that.
I want to go back to what you said as far as someone can 302 someone. What happens when you have, say, a neighbor, not someone that you're related to, that is just wreaking havoc in the neighborhood,
Mm-hmm.
wreaking havoc with the neighbors, but has not physically touched anyone? But I mean, it's just the verbal abuse.
Mm-hmm.
What can neighbors do at that point if they have a neighbor that they know have a mental illness, but it's just like very often the verbal abuse, but you know this person has a mental illness, but it's still alarming, it's disturbing, and it's emotional. What
Yeah.
do the neighbors actually do when they find out one of their neighbors has a mental illness?
Yeah, I mean, I think that this is a really good question, and one that I don't necessarily have a great answer for. I think, um, it's one of the great challenges of our society is um, we don't really have great, options for um, the care of, like our less sort of what we call neurotypical um, folks. And, I think our culture doesn't really know what to do with folks when they um, sort of step out of the norms. It feels very uncomfortable. It feels very off-putting. Um, and it can feel very alarming when people are having um, very emotional experiences right in front of us.
Right. What resources are available besides 302ing someone who has a mental illness? So someone who has a mental illness, and they may not be causing any havoc among anyone, but what resources are out there for family members?
So I recommend there's always mobile crisis, and that number is 215-685 6440. Um, and they're a great resource because they will actually come out and they will actually engage with folks in the moment. I mean, they sometimes will take a little while to come out because there unfortunately aren't enough units in the city, but they're a great option in the moment. I also recommend NAMI, NAMI has groups, and they've got groups both for the consumer, the person who has a mental illness, but also for family members. Because I think it can be really helpful when you are able to talk with other people who are also dealing with the same kind of concerns and worries, and can kind of brainstorm how best to handle these things.
Do you see often that people will call 911 when someone who has a mental illness and their behavior is not normal and they're in the streets? Do you see that 911 is called often? And I can just, I hope that the officers that come out are trained to deal with people who have a mental illness. And let me be the first to say, I have many officers that I have worked with since I've been in the victim services field, and all of them are awesome. So I am all for the Philadelphia police. They are awesome. But I know I can imagine that that's very crucial.
Yeah, it is.
And training is needed and required.
Yeah, it is. And, I think there are some really great folks. I've spoken with some officers who are great, who just have great instincts. And then you see the situations that are the worst case scenarios. I have a friend whose brother was recently killed, not here in Philadelphia, but elsewhere, because he was having a mental health issue, and the officer responded by shooting him. We saw the situation here in Philadelphia with Walter. So, it unfortunately, in high emotion situations, we need folks to be as well trained and calm as possible. And it is a very concerning situation when there's a gun involved.
It is. Now, how would you recommend family members, neighbors, co-workers to de-escalate or to interact with a person who has a mental illness and they're at their highest level? How do you recommend we interact with that person?
Yeah. So, some basic de-escalation techniques are just to remember to use a very quiet voice. Never to try to approach people, because if you're approaching them, that feels very threatening. Always to keep your hands visible but low so that it doesn't seem like you're trying to grab for people. And, in terms of actually speaking with folks, trying to use as not too many words, because you want to listen as much as possible, and really try to work towards compromise as much as that's possible with someone who's probably not thinking too rationally in the moment.
Okay. And you're local, correct?
I'm right at Einstein.
Okay. Which I love Einstein. Love Dr. Harris. Shout out to Dr. Harris.
She's great.
Do you find that some people with a mental illness actually check themselves into facilities when they feel like there's a difference going on with me mentally? I need help. Does that happen?
Oh yeah, absolutely. I think, when folks are in tune with their own mental health, um, folks want to feel better and um, will, access the services they need.
Okay. So before we wrap up, please tell me and the viewers, how can I practice more self-care? Like, again, I told you today was just an unbelievable day for me.
Mhm.
And I know it'll probably hit me a little later on because I was strong for my son, I was strong for my daughter-in-law. And like when we met up, they broke down and I had the kids. And I understand sometimes a cry could be a very good cry. So help us to understand what we can do for self-care so we can let go of those stressors of the day. We can somehow get over that traumatic experience and then be refreshed for the next day. So how do we let go of these things so that way we're not piling them up in our mental bank for them to
Mhm.
overflow and cause something traumatic? So what kind of self-care can one do daily to be able to just cleanse themselves?
Um, well, I think that some basic things that I really try to emphasize with my patients is just making sure that you're doing truly the basics, eating and sleeping, and really focusing on that every day, making sure you're getting enough sleep and eating healthfully. Um, but I also believe that trauma is held in the body. So making sure that you're focusing on your body by doing some exercise, however that is going to happen. So whether it's just like throwing on some music and dancing, or going for a walk with your friend, um, but just somehow getting your body moving so you can get that trauma out. Um, because otherwise, we live very sedentary lifestyles and we're just kind of, hunched over our screens, and it builds in our body. Um, and there's so much research about being out in nature that being in a green space, whether it's a park or the woods, helps us. It just brings down our sympathetic nervous system, which is our adrenaline.
Sounds good. And shoe shopping might not be that bad either, right? Talk about pleasure.
A little dopamine hit every now and then of shopping.
So my husband, listen, I need 5 new pair of shoes to bring my stress level down just a little bit. That's what Dr. Noble said.
um, Oxytocin. So oxytocin is it's the connection hormone. It's what we get when we um, see a baby and hold our lovers and pet a dog. So that is, you can't have high adrenaline if you're shooting out oxytocin. So
Okay, that sounds good. Dr. Noble, I want to thank you so much for joining me today.
thank you.
Thank you so much for joining me today for this very, very important episode of The Power of One. I believe we all know someone who's suffering from a mental illness. Please be kind to them. Please love on them. And please try to help them in any way that you can. The power of one starts with you. Peace and blessings.